of the cardiac dysrhythmias and death associated with foot and mouth disease, especially in case of the cows. The purpose of choosing this specific topic is at least to prevent the death to the extent of the 25%, because there is a death associated with foot and mouth in case of cows, and lot of calf mortality is there, and it is going to cause a lot of economic losses to the farmers in terms of the money, and also the cattle population is reduced. Whenever there is an outbreak of foot and mouth disease, can we go for some treatment? So that's why my aim is there, and with this, especially the introduction, etc., I will go with the introduction of this topic, especially about the foot and mouth disease. It's a very well-known virus. I will not take much time for this. Later, the different diagnostic techniques in very brief, then about the drugs which can be used in the treatment of the cardiac disorders which are associated with the foot and mouth disease, and ultimately will conclude what a take-home message to the veterinarians are concerned. So coming to the introduction, foot and mouth, or the FMD, is an acute, highly contagious viral disease affecting the worldwide. And of course, it is affecting almost all the cloven-footed animals, including 70 wildlife species and also the domestic animals. So it is classified within the Aptovirus genus as a member of Picornaviridae family. And we can also see that several types of the seroprevalences are there. The foot and mouth disease virus is having several that's why the vaccination is being failed, and sometimes even though there is vaccination, later because of the new variant of the virus, the disease is being spread. That's why foot and mouth is classified as a list A disease by the OI, that's official International Death Episode, is World Organization for the Animal Health. So this can spread extensively between the countries and can cause severe impact on the economy, and every veterinarian of the country has experienced this thing. And till now, 7 distinct serotypes of FMDV are identified with the same clinical effects. The serotypes are OAC, South Asia, African territories, SAT, that's SAT 1, 2, 3, and Asia 1. And everyone knows this thing, and I need not tell. So very specifically, we can say that this virus is highly contagious and can spread in case of West Africa, East Africa, and also there are variants of this Indonesia, then Middle East Asia, Southeast Asia, etc. Then the foot and mouth disease virus is going to bind with that of the cell membrane, then it is translocated, and then later it affects. And recovery from one serotype infection will not provide immunity against another serotype infection. That's why many times, in spite of the vaccine, there are outbreaks. The second, third outbreaks are also being seen. And also, after acute stage of the infection, foot and mouth disease virus can cause symptoms. Less persistent infection is there, and they are called as the carrier animals. So they become very carrier animals and propagate the disease to the other animals. And when convalescent animals are vaccinated, which are the animals exposed to the live virus, carrier state can occur. That's a very well-known factor to most of the veterinarians who are in this particularly webinar. So the disease is noted for its very high morbidity, but mortality is not so much, except in case of suckling animals. And we have also noticed that in our area, maybe in Chikkabalapur or Kolar, in the previous outbreak, a lot of animals have died. To the extent of 10% animals have also died. Of course, the established literature say that the risk of occurrence of myocarditis associated with foot and mouth disease is higher in young animals than the older one. That's why we have to concentrate on the young animals rather than the older ones. And affected calves die without any clinical signs. That's also a alarming sign, because if any clinical sign is there, then we can go for the treatment of the said animal. See here, there are certain facts that the mortality is up to 5% in adult animal whenever there is a cardiac attack is there, and it shoots up to 50% in case of the young animals, that is especially the cows. which die due to the myocardial damage, and as everyone knows. So in cows, myocarditis develops without the oral lesions also. Many times the oral lesions like chopping up of the mucous membrane, etc., are seen, and such the type of the typical characteristic of the foot and mouth is not occurring, but the cows are going to die. And the death of the cows suddenly occurs without any apparent clinical signs, and calf death occurs due to the cardiac problem in general. But we can see varieties of the cardiac disorders where we have got the histopathological changes, the cardiac rhythmic pattern, etc. And the rate of mortality is very high, especially in case of young cows, and especially most of the cows die. 50% of the cows are going to die, especially case fatality is very high. And the myocarditis in young animals is characterized by the hyaline degeneration, what you can see in the slides, and necrosis of the muscle fibers, then intense infiltration of the lymphocytes. All these are the histological lesions, and without any apparent clinical signs, the animals are going to die. That's how. And in this, particularly in this slide, you can see that it is called as the tiger heart appearance or tigroid heart appearance. That is the cause of the death, especially in case of the infected cows, and postmortem clot, particularly or popularly known as the current jelly clot, which you can see in the yellow circled area. And the section of the heart, especially in this one, you can see the section C of the heart muscle with focal necrosis and infiltration of the mononuclear cell. I am thankful to the authors, especially it's from the article. Yes, this is the tiger stripping, or it's also called as the focal myocarditis in the heart. And there are pale areas of the necrosis, especially on the lamb with the foot and mouth disease. So the foot and mouth disease, the death is totally attributed to the myocardial failure, and we can see that the vacuolated degenerated myocardial cells, especially in the microscopy, or the necrotic myocarditis in the lamb heart. Of course, the similar type of the lesions are also seen in case of the calf heart. And of course, this is very well recognized in case of the large areas of vacuolated degeneration, and also the myocardial muscle cells and several vacuolated degenerated cells, especially in the cardiac muscle cells. So apart from this one, the acute myocarditis, it will be distinguished by the hyaline degeneration, muscle fibers, and infiltration of the few of the lymphocytes, as shown in case of this slide. And histopathological examination of the heart of the cattle, adult cattle, reveal hyaline degeneration. And if there is a death in case of the adult cattle, that is totally attributed to the myocardial failure, and there will be multifocal necrosis with accumulation of the huge lymphocyte. The purpose of telling all this is to go for the correction of the cardiac rhythms or arrhythmia, which is happening in case of the young cows, and they have got little time to survive following the cardiac necrosis. Hence, these are the deposition of fewer lymphocytes. Hence, we have to treat those cows with as early as possible, as fast as possible, for the especially in case of cows. And before going to the treatment aspect, we have to diagnose the condition as much as possible wherever the facilities are available, or else we have to know this type of the knowledge, especially the most important cardiac biomarkers released after cardiac injury in animals are the creatinine kinase myocardial band. It's also called as CKMB or CK-MB. And another enzyme, that is lactate dehydrogenase, is there, LDH, it's the short form, and aspartate amino transferase, or it's also short formed as the AST. And nowadays, this cardiac troponin 1, which is abbreviated as C small, T capital, N small, and I capital, or CTNI. So this is one of the most important and very accurate biomarker. Though the diagnosis of the disease associated with foot and mouth is based on physical examination, then a and the incidence of the death. These are all the three things how we can diagnose this disease, or else we have to go for the blind treatment. That should not happen, especially whenever it is treated from the qualified veterinary graduate. So the cardiac injury is indicated by many biomarkers, as I have already told. It is narrated by Jeffy et al. In case of 1996 itself. And we can see that CKMB, creatinine kinase myocardial band, is from the cardiac muscles, and we will see what is this. Especially arginine and glycine, they are going to combine, and they are going to cause this guanine adenoacetate, and it's converted to GAMT. And this is how the creatinine biosynthesis occurs, especially in the muscle fibers. Later it is released into the circulation. Whereas these creatinine transporters are there, and they are going to carry the creatinine, and they buffer ATP with ADP. Then ADP energy transport is there. Then of course the energy storage is also there. And later it is released into the circulation, and we are going to estimate this thing. And of course, these pyruvates are going to combine with that of the NADH, and the lactate dehydrogenase is going to cause this release of lactates and NAD. So these are all the molecular mechanisms, how these biomarkers are important, especially in the diagnosis of this particularly foot and mouth disease in case of the cows, because there are no apparent clinical signs of the characteristic foot and mouth lesions. And of course, in case of the liver also, it plays also important role in the production of the certain biomarkers. In case of human beings, it is very important that CKMB concentration peaks 24 hours after initiation of the cardiac injury. Cardiac muscle fibers, they get injured, and within 24 hours, this CKMB will increase, whereas the LDH peaks during 48 to 72 hours after 2 or 3 days of the attack. The tissue specificity and the sensitivity to these enzymes limits the effective use of these enzymes in detecting cardiac injury. So what we can say is these enzymes are not so accurate. So cardiac troponins, especially cardiac troponin 1 or CTIN1, is found to be the best cardiac biomarker, especially in case of the myocardial injury. Suppose in a herd, especially in the big organized forms, if FMD outbreak is there in the large cattle, then we can diagnose this type of the cardiac problems by estimating the cardiac troponin 1. So it is a very highly sensitive than that of the CKMB, LDH and AST, and it is the unique troponin expressed in the myocardium. So the myocardial troponins are released from the cardiomyocytes and released into the blood. So this is the way how the troponins are released into the blood circulation, and how it becomes the important biomarker, especially in case of the foot and mouth disease diagnosis. Especially cardiac problem, the troponin starts to increase 3rd to 4th hour. So that's why it is in the very early stage we can diagnose the disease, and peaks at 12th hour after the cardiac injury. Death occurs very early to the myocarditis associated with the foot and mouth. So increased concentration of the CTNI and abnormal levels of the CKMB and LDH will be noted in the animals with arrhythmia associated with the foot and mouth during the early stages of the disease. And many times the calves die without any apparent clinical signs. So these are all the lesions, how the myocarditis causes the heart muscle to become thick and swollen, and the cardiac muscle fibers are damaged, and the troponin 1 is released from the cardiac muscle fiber and becomes a very important biochemical marker for the diagnosis of the poisoning, especially diagnosis of the cardiac arrhythmia. So the normal heart is usually, it is having the normal structure with sinus node, normal electric pathways, and atrioventricular node, everything will be normal. Whereas in case of the cardiac arrhythmia, in case of foot and mouth disease, in case of cows, there will be atrial fibrillation, and the impulses will be there, and chaotic signals are there, and the rapid ventricular impulses are there. That's called as the atrial fibrillation is always present, especially in case of cardiac arrhythmias. So this detection of CTNI is one of the most sensitive method of detecting myocardial cell, especially in the earlier stage. If you estimate this thing, especially in the cows, and it becomes one of the most important biomarker. The age of the animal is directly related to the risk of myocarditis due to the foot and mouth disease virus, and it's higher in case of cows, which are less than that of the 2-month-old. So most of the suckling cows are highly susceptible to the foot and mouth induced death, especially. So that's why the death rate is, even though it is said as 50%, sometimes it increases up to the extent of the 75% also. Once again, it depends upon the species of the, especially the variant of the virus and the mutagenic type of the genes. So troponins are the globular proteins on the thin filament of the striated muscles and responsible for contraction and relaxation of the striated muscles. So once again, in the troponins, there are 3 subunits of the cardiac troponins. One, let's say troponin I, or one what we can say CTNI, the cardiac troponin T, then the cardiac troponin C. Whereas these are all the, you can see that diagrammatic representation of the troponins distribution. Myofibrils, it is 94 to 97% distributions, and cytoplasm, it is 3 to 4. So troponins, as usual, I have already told that it is classified into T, I, and C. Or the troponin, whenever there is a injury to the cardiac muscle fiber, it goes to the circulation. That's how it becomes one of the very important biomarker. So how to diagnose this troponin is, we can take the same type of the human kit, and in the blood we can find out the troponins, and especially in case of heart of the cows with foot and mouth disease. So we need not treat all the cows as and when it's required. So we can go for this strip test very easily, which can be done, and we can diagnose. So the reactivity of the CTNI is one of the more myocardium than the case of these skeletal muscles. Of course, they also release certain troponins, but homology between human and bovine CTNI is higher. So that's why the cardiac troponin tests produced for the human use. So please remember that the cardiac troponin tests produced for the human use can be used in case of cattle, as the antigenic similarity between the human and bovine is 96.4%. That means almost equal to that of the human beings. We can use that particular kit and diagnose the cardiac damage in case of the bovines for the better line of the treatment. So this is also another illustration how cardiomyocytes are going to be damaged, and apoptosis occurs, then exocytosis occurs, especially troponin, and the physiological cell turnover is also there. So the troponin complex, here you can see that troponin I, C, and T are there, which are smudged in between the actin and tropomyosin filaments. So the positive results for the cardiac troponin indicates that red band is formed. In the second one, this you can see negative control line, the negative results. In case of say single band appears a negative result, whereas the positive line is this 2-1, and positive results for cardiac troponin in case of the serum. So you can purchase the human kit and test it directly without any problem. And it is also one of the good indicator of the myocardial injury, but no more sensitive than that of the CKMB for acute myocarditis. It cannot be. So CTNI concentration more than 1.3 milligram ml are diagnosis of the myocarditis with sensitivity, specificity to the extent of 90% and 100% respectively. So overall, this saying is CTNI is one of the important parameters that need to be estimated before we go for the diagnosis of the foot and mouth, especially in case of cows, because many times what happens if we use the drugs, there is chance that these drugs cause the sudden death and cause especially the cardiac fibrillation in case of the cattle. And the types of arrhythmia, especially in case of the foot and mouth affected cows, we have to know, because if we know the type of arrhythmias, then we can go for several drugs are there. Lot of classifications are there, especially in case of anti-arrhythmic drugs. Hence, we can select a very suitable drug which is available very properly in the market with cheap cost and less toxicity. So foot and mouth disease virus has high affinity towards the actively growing myocardial cells, especially. That's why the young cows are more susceptible. Young animals are more susceptible when compared to the adult. The development of focal areas of the inflammation, hypertrophy, consequent to the viral myocarditis, show down the action potential. So the myocardial action potential is totally slowed down, ultimately leading to the formation of re-entry circuits, and ventricular arrhythmias are there. So that's called as the ventricular arrhythmias. So apart from this one, the cytokines released during this inflammation are pro-arrhythmic and may cause ventricular arrhythmias more and more. That's why the cows are going to die without any apparent clinical signs. And monoformic and polymorphic ventricular premature complex, that's also called as this VPCs, ventricular premature complex. Especially in case of the, I think many of the audience are here, the cardiology is not a well-developed science, especially in case of the large animal medication, but we need to focus a lot, at least to the extent, certain extent, we have to know, so that we can choose better drugs for the treatment of the ventricular premature complexes. We are the common arrhythmias found in cows affected with the foot and mouth diseases. So here you can see that abnormal electrical signals will cause the abnormal cardiac rhythms, or it's also called as the cardiac arrhythmia. There is a change in the QRS complex and also the P and the T waves, which is due to the damaged heart muscle, which causes the impaired impulse conduction. So also here we can see that whenever there is a heart is going to pump, then the QRS complex, etc., they are going to change. So here the most of the death, especially in case of the cows, is due to the sinus rhythm, especially a study conducted by Gibler et al. In 2016. It says that out of 81 cows, 19 death is due to the sinus rhythm. And apart from this one, varieties of the other diseases of the heart are also there. Polymorphic ventricular premature complexes, it's up to the extent of 11. That's also 14%, and 8.6% is monomorphic ventricular premature complex. 6.2 is ventricular tachycardia, ST segment elevation in 11%, then premature junctional breeds. So many times the large animal practitioners might not have heard all this very specific terminology, as it is very difficult to do the, especially the ECG, etc., in case of the animals. So the atrial fibrillation also, it is shown as 7.4%, and low voltage QRS complex. All these are the cardiac abnormalities that is shown, especially in case of the animals. And type of arrhythmias, especially in case of affected with FMD serotype O, it's a very common variant. This OACACA1O variant is very common, and the incidence of mortality in animals is, especially FMD, is due to the cardiac problem, is atrial fibrillation 83%, and polymorphic, this VPC group, is 82%. This low amplitude QRS complex 75%. Please note that VPC means ventricular premature complex. So most of the time the death is due to the atrial fibrillation, and or many times it is combined. And now we will come to the treatment and management of the cardiac disorders, especially in case of the cows. So the number one, suppose in a herd we can suspect the cardiac problem. The supportive treatment includes the ampicillin and cloxacillin antibiotic at the dose rate of 10 milligram per kg intramuscularly twice daily for 3 days. So this is a paper noted by Priyanka et al. In the especially from the IVRI. And flunixin meglumine, they have done one study at the dose rate of 2.2 milligram per kg. It need to be administered very slow. Intravenous administration is required. Once a day, need to be administered for 3 days. it is required. And flunixin meglumine is one of the very well known. This especially the NSAID is there. Then apart from this one, we can also see that then the cows should be isolated and hand fed with milk and gruel or porridge during the entire line of the treatment. It should be there. The lesions on the mouth, if they are there, it's very rare that the lesions will be there, but if they are there, they should be washed with, as usual, 1% potassium permanganate or the boroglycerin paste need to be applied to all the cows or the animals. And please remember that most of the animals affected with the foot and mouth disease are always infected with the cardiac problem, and they will the death, even though there may not be any death chance, but the cardiac muscles are severely damaged. Many times it is noticed and many times it is not noticed. So that's why you can go for the general line of the treatment. And polymorphic, this ventricular premature complex, to be treated by administration of the 2% lidocaine, because this is the class 1B, that's antiarrhythmic drug, 2% lidocaine at the dose rate of 0.6 milligram per kg, slow intravenously. Once I am repeating, it needs to be administered very slow intravenous over 15 minutes once a day till the disappearance of the cardiac arrhythmia is to be conducted. Then potassium permanganate or the porridge, means maybe a gruel of ragi or any other rice, etc., need to be administered to the cows because they need the very light diet and the boroglycerin. So there is what happens after the administration of these drugs. A significant clinical improvement we can see will be noticed after 3 days of the treatment, when the rectal temperature will return to normal physiological range as reported. Or many times we cannot see such type of the recovery pattern or the temperature, etc. There will not be there. Even then, internally, there will be cardiac damage, and about 42 hours after the arrhythmic treatment, the heart rhythm will change to intermittent unifocal VPCs or the ventricular premature complexes occurring at the rate of 9 to 12 VPCs per minute. That's how the research says. And after 72 hours of the arrhythmic treatment, sinus arrhythmia will usually resolve. So this is the electrocardiograph pattern which is conducted by the Priyanka et al. Of course, in the field conditions, this is more difficult, but in spite of this thing, if the facility is there, one can conduct this thing and test about the recovery rate. So this is the electrocardiogram show the multifocal ventricular premature complexes, or the VPCs of different morphology are indicated by the asterisk here, different marks, asterisk marks of the different color. So sinus rhythm, especially SR means this is the sinus rhythm, and especially different type of this, totally the QRS complex may be inverted, and here the paper speed was set at 25 mm and the sensitivity of the ECG machine was kept as 1 millivolts per 1 minute. So that's how, if the academic people want to do the research, etc., they can take it from this thing. And electrocardiogram after 48 hours of this recovery or the treatment showing unifocal ventricular premature complex. So especially the cow had recovered, and many times the animals will recover after 42, or sometimes they may take the 72 hours also, depending upon the this troponin content, how much high it is. So later, after this 72 hours, most of the animal get recovered, unless and until there is a very severe cardiac problem, or if we have started the treatment very late. That's how it says. Then the lidocaine, why it is very important here is, it is an antiarrhythmic burst, especially class 1B or Vaughan-Williams classification. We see in the lower chart, you can see varieties of the classifications of these drugs are there. So the lignocaine or the lidocaine is a very popular drug which is used as a local anesthetic very commonly, and the cost of this drug is also very cheap. So it blocks the sodium channels in the conduction system and in the Purkinje fibers of the heart. So we can see that this is especially the class 1. It 1A contains the quinidine, of course the class 1B, lidocaine and mexiletine, and apart from this one, many other antiarrhythmic drugs are also there, whereas this verapamil and diltiazem and other drugs, see there the absorption of these drugs is it's a question mark. And of course, the potassium channel blockers like amiodarone, sotalol, etc. are also there. The beta blockers, especially the propranolol and metoprolol, can also be used in several types of the cardiac arrhythmia, especially in case of calves. So here you can see that the drug raises the depolarization threshold, therefore making the heart less likely to initiate and conduct early action potential. So this raises the threshold of the arrhythmia, so that the arrhythmias which are occurring due to the cardiac myofibril damage will be drastically reduced. That may cause and ultimately the animal will recover. And apart from this one, another line of the treatment may be the flunixin meglumine, maybe the meloxicam, or any non-steroidal anti-inflammatory agents can be effectively used in case of the foot and mouth induced cardiac arrhythmia. Here you can see the classification just for your curiosity. The class 1A drug, quinidine. Of course, it is little bit toxic, hence we cannot administer this thing. Other drugs are very much limited to the human use. Of course, the lidocaine and phenytoin. Yes, we have used these two drugs, and of course, the mexiletine is also available as one of the very commonly prescribed drug in case of the human cardiac arrhythmias. And class 1C, of course, these are all little costly, and the class 3 drugs, they are also little costly in nature, and many times they will not be available as and when is required. So what is the use of this flunixin meglumine? A classical non-steroidal anti-inflammatory agent. It might have contributed for the faster recovery of this animal by reducing the production of inflammatory cytokines. Especially, it is a very specific COX-1 type of the inhibitors, enzyme inhibitors, and hence these special inflammatory mediators which are going to cause more and more cardiac damage may be totally reduced. And the lidocaine is used predominantly for acute treatment of the ventricular arrhythmias. Of course, the animal is suffering and already it is having the lateral recumbency. Then at that time, you need to administer the lidocaine, one of the most cheapest drug. But it has no efficacy against supraventricular arrhythmias and minimal effects on the autonomic nervous system. So we can administer it so that the lidocaine or the lidocaine, but it is ideal for the acute treatment only in case of acute problem when the case is very severe. Then you can go for the treatment of this lidocaine. And because it has a rapid onset of the action, because you are administering it as intravenous route, less than 1 hour in case of a dog, and cats especially, that has been already proved. And the short half-life facilitate the rapid changes in the serum concentration, as you are seeing in the right side panel. So in the liver, it is going to be converted to 2,6-xylidine and or else some other metabolites which are fastly excreted from the kidney. So lidocaine is extensively metabolized by liver, thus hepatic diseases and reduced hepatic blood flow can prolong the half-life. Because if you use the other antiarrhythmic drugs, then especially in case of acute problem, it may not act very fastly. Then at the same time, the hypokalemia sometimes seriously impairs the efficacy of the lidocaine. So lidocaine is available only as parenteral formulation for intravenous administration. Everyone has used this thing in case of so many disorders, especially epidural injection, local anesthetic agent, especially the nerve block and many more. It's very commonly used. But you should take certain very important cautions that it should not be infused through the same catheter or line with the other medications what you are going to be administer. So you use separate catheter. A typical clinical approach in the animal is to administer 2 milligram per kg as IV bolus over very slow. That is the 1 minute, less than 1 minute to affect slowing the ventricular arrhythmias or this especially conversion of sinus rhythm. All these are the complexes that are present. Or to cumulative dose of maximum 8 milligram. It is containing 2 milligram per ml. So over the 30 minutes, you have to administer it very slowly. Then given the very short half-life, repeated bolus of constant rate infusions are also available in certain human preparations are there. They are called as the constant rate infusions. That they are called as CRIs. So they will be administered 25 to 75 microgram per kg per minute and is needed to maintain the rhythm to control. So this can followed by the CRI 10 to 20 microgram per kg per minute. So that's also another lineup. So there are certain toxicities of this lignocaine I want to share with you is toxicity is manifested in case of dogs. It is not studied in case of cows, but it's extensively studied in case of dogs as GI and sudden CINS, sinuses also there, and sometimes sudden collapse of the animal is also seen if you administer it fastly, as it is going to impair the potassium channels. And drowsiness or agitation may progress to muscle twitching and convulsions at higher plasma concentration. That's also another thing. And hypotension may develop if the IV bolus is given too fastly. So never hurry, especially when you are treating the cows. Take some time to administer it in the case of the fluid with very slow administration. Never administer it as such without dilution in the fluid. Many times the veterinarians will not have time. Suddenly they infuse this particularly dose. That should not be, because the lignocaine hydrochloride is never administered through any other route apart from the slow IV route. So don't try all other such type of the activities. And apart from this one, the another drug, what alternative to this lignocaine, if you fear very much or sometimes the tablets need to be prescribed, then phenytoin sodium is a drug of choice. So this is formerly, it is also called as this diphenyl hydantoin, and is one of the most commonly prescribed anticonvulsant. Of course, it is the classification is done as the anticonvulsant. Many times the human preparations are available as heparin injection, and many more injections are available, especially for the human use. And in veterinary medicine, its use is reduced because of the pharmacokinetic differences and susceptibility to the adverse effect. Earlier, it was used to the greater extent. Now, it is not recommended for the anticonvulsant drug, especially for dogs and cats. Many times the metabolites are toxic. That's how. But it is one of the very nicely acting anti-arrhythmic drugs in case of most of the animals tested. Of course, the data is very less. I have tried to collect it as much as possible. So the mexiletine is another drug. It is an oral analog of the lidocaine. So mexiletine is available very commonly, but the cost, you can see that it is very high. Cost is there. Mexiletine 150 milligram. These tablets are available, and one can go for 8. And it is a very commonly used agent. Of course, the many people in this group may be small animal practitioners. Especially, this is very effective in using the ventricular arrhythmias in case of the dogs. Whereas it is not used as the monotherapy for ventricular arrhythmias. It is most often adjunctive to the treatment in case of severe chronic ventricular arrhythmias not well controlled by the sotalol or the dogs that do not tolerate sotalol. Many other drugs are also there. So it has fallen out of the favor of treatment of the people. Thus, its availability nowadays it is limited, because even though it's one of the most effective drug, because of certain side effects, its use is reduced, especially in case of the human. Apart from this, it has got certain limitation. We have to go for the benefit and risk ratios, because any drug which is effective will have a definite side effect. That's the first notion in case of the pharmacology. Anything which is effective against the disease will have a definite side effect. If it is not having side effect or claimed to not having side effect, it will not have any effect. That's how the pharmacologists we say. So hepatic enzymes should be elevated before the treatment and periodically during the chronic treatment as well as the anytime. So there is a chance that the GI disturbances may also happen. So the dose of this drug is 4 to 6 milligram per kg orally TID for minimum 4 to 5 days is required. Then of course the cost may be high, but if the owner is needed to be advised very properly that this drug can save the life of the animal. And atenolol, of course, this is one of the very commonly used drug in case of the human practice. So this is also class 2 antiarrhythmic drug. Please note that it is a selective beta blocking agent and it's the more commonly used as a in case of veterinary medicine. This is very commonly used in case of dogs as antiarrhythmic drugs. So it is beta 1 selective. It has less potential to cause for the contribute the bronchospasm as the bronchi smooth muscles do contain beta 2 blockers. And the dogs and cats, so beta 1 selectively it is going to block. That's how this is going to cause the antiarrhythmic drug. So the dose is especially 0.2 to 0.1 milligram. It is available as the tablet 50 milligram tablet is available. Then you need to taper the dose till 5 or 6 days. Then potential adverse effects are dose related and more likely it is by systolic function is present, and adverse effects include the myocardial depression. Sometimes the bradycardia is also there, or the bradycardia may be sinus or the AV block, and hypotension may also be seen. Sometimes it may require the medical team. Apart from this one, the another drug which is also a human product, and it is the class 3 drug with a variety of other properties. Its predominant electrophysiological effects prolong the refractory period. So, of course, these are all the sodium channel blocking properties, sometimes these class 1 drugs, etc. So, one need to know this, especially the cardiac pharmacology and cardiac physiology very properly before going to use any of these drugs. Later, I am going to summarize this thing because nobody should get confused. What are all the drugs need to be used, etc. So then amiodarone is used to treat the life-threatening ventricular arrhythmias, especially this, it is used because of its effectiveness in the treatment of both ventricular and supraventricular arrhythmias. Because in case of the cows which are suffering from the cardiac disorders, there will be ventricular and supraventricular arrhythmias are also there. So these are all the other choices of the drugs apart from the mexiletine, propranolol, and amiodarone. So this is the way how this class 1 sodium channel blockers are going to act, and class 3 and class 2 dilatism, etc. going to act. So these once again you need to measure the cardiac troponin for deciding the dose of a particularly especially in case of the cows. That's the best type of this thing. Most of the time, in case of human beings, this is followed. But the test kits are available for the detection of human, can be used in case of cattle, as I already told, and the result is 96.4% accuracy. So ultimately what we can say is cardiac arrhythmia due to the foot and mouth can be treated with 2% lidocaine. Suppose it's acute condition at the dose rate of 0.6 milligram, very slow intravenous, then flunixin-meglumine 2.2 milligram per kg may be used. It is going to reduce the cytokine production, and the mortality percentages of cow, especially foot and mouth associated, may be reduced by, first of all, we have to diagnose early, then using the kit, or many times this, if we are quite confident enough, just auscultating the animal can only also indicate. If you auscultate about 1,000 cows, then you can see how much, what is that, without any ECG or any other thing. So what is the use of this NSAID? Not only the flunixin-meglumine, but many of the COX-2 inhibitors are also effective. And apart from this one, this aspirin can also be used as the alternative drug, acetyl salicylic acid, and many times it's available, especially in case of human being. even though it's highly toxic in nature, which causes the gastric ulceration, but it is one of the effective agent. So it causes the abomasal ulcers, especially in case of the cows and also the larger animals. Many times the ulcers are very common in case of the animals which are suffering from the theileriosis. So the dose of this aspirin is 5 to 10 milligram per kg orally BID for 3 days, minimum 3 days need to be given. And you may ask the question, any antiviral drugs can be used in case of foot and mouth? Of course, it is too primitive to say, because already research has been taken place that the ribavirin, 5-fluorouracil, 5 this thing, and many of the drugs will protect against FMD virus, as these are anti-RNA viruses. And nowadays, recently this flavipiravir is also said to be effective in case of coronavirus, but it requires very high dose, 200 to 400 milligram per kg. So the ribavirin is effective in protecting against the foot and mouth disease virus that depend on administration in most of the routes in the experimental study only, but still it needs the further pharmacological evaluation. Both IP and IM inoculation resulted in 100% survival rate in case of mice. The same study need to be done in case of foot and mouth affected cattle also, because many people, especially Joe Yang Choi et al. In the 2018, they have done a very extensive review on this thing, and they are indicating many antiviral drugs, but the cost of this antiviral drug is very high. At the same time, many times we do not know the kinetic pattern of these drugs if they are given orally. If injections are available, well and fine. Many times this injection of this ribavirin, etc., they are available, which is 100 milligram per ml. And apart from this one, this Brequinar, it is under the clinical trial at the rate of 50 microgram. So some, especially the students, can note on all these things, because the new drugs are there for the treatment of the foot and mouth disease virus. We do not know, someday it may come, because we cannot 100% cure or prevent the foot and mouth disease. Even after the vaccine also, it takes some time to get the antibody. So we have to be ready to treat the disease with certain drugs. So Brequinar, it's available as the 50 microgram, and it provided 25% protection for 5 days following FMDV challenge. In case of the mouse model only, it is tested, but till it need to be tested in case of the large animals. And these results suggest that the Brequinar could be used as effective antiviral agent. So we do not know, after whether 5 or 6 years, this drug may eradicate the foot and mouth. Nobody knows about this thing. But now at present, the cost factor and toxicity of the antiviral drugs is the limiting factor, and lot of study need to be conducted. Here you can see that Brequinar, especially, it is going to inhibit the functional proteins, and protein degradation is being caused, especially that's though. Apart from this one, another one of the important news to the veterinarian, that ivermectin, suppose recently Zahra Naeem et al., they have published a paper, especially in case of this ivermectin. One of the interesting thing, please note down, in vitro antiviral efficacy study of the ivermectin has been conducted with FMD, a common virus in case of the variants, and it was found to be effective against foot and mouth disease virus. So this is very surprising result. And of course, this you may be knowing that in the corona treatment also, another RNA virus, it has found to be effective against the foot and mouth disease virus. But the study revealed that the virus titer was drastically reduced more at the replication stage as compared to the attachment of the entry stage, especially. But this is a in vitro study. Please note down that this is an in vitro study. In vivo experiment evidences are very much required, and in case of the cows, especially under 2 months age, the use of the ivermectin is need to be questionable, because it may cause severe toxicity also. That's why one need to be very careful. However, I think we can use this in the adult cattle as one of the precautionary measure. So how it is, this is to summarize the entire presentation. Affinity of the foot and mouth disease virus, actively growing myocardial cells. Then there is a development of focal areas of inflammatory fibrosis, hypertrophy, consequent to the viral myocardiopathy, etc., slow down the action potential and ultimately leading to the formation of the re-entry circuits and ventricular arrhythmias. And because of this thing, the cytokines are released during the inflammation, and these cytokines are highly pro-arrhythmic. They induce severe myocardial fibrillation, and that's why the flunixin meglumine, maybe the meloxicam, or sometimes the aspirin, these drugs are very commonly used. And elevated CKMB or creatinine kinase myocardial band and the cardiac troponin, these are the indicators of this cardiac injury. And later we can also see why this lidocaine is very popular is it is going to prevent the ventricular arrhythmias and the ventricular fibrillation and polymorphic ventricular cells. Of course, the phenytoin sodium can also be used, and apart from this one, many other anti-arrhythmic agents can also be tested. But there is no data as on these things, and the academicians or the researcher need to take much more research. So coming to the summary of this entire presentation, I want to make it very clear to the veterinarians who are practicing is, you may ask the question, many of the drugs you have told, what are all the drugs need to be used in this? So suppose the antibiotic therapy is very much required, because many times whenever the cardiac muscle fibers are damaged, few of the varieties of this bacteria are going to affect the heart, maybe the gram-positive staphylococcus or sometimes the streptococcus. So for this, we can simply use amoxicillin plus cloxacillin preparations, maybe the 10 milligram per kg, slow IV or IM for 2 to 5 days. Especially the course of the antibiotic need to be followed. Apart from this one, the fluoroquinolones can also be used, or the cephalosporins can also be used. Of course, there are no data on these drugs. The efficacy of these drugs are already there. But in case of foot and mouth disease-induced bacteremia, it is not used. The second line of the treatment, suppose the calf is suffering from the foot and mouth already, then you can go for the lidocaine 2% at the dose rate of 0.6 milligram per kg, slow intravenous. Usually the calf will be weighing about 30 to 40 kg, then it may require 3 to 4 milligram. So over the period of 15 minutes, then this need to be done with caution, or else it may end up with the cardiac arrest. So little slow you have to administer, don't worry about this thing. Other than these alternative drugs, so if you are unable to administer the lignocaine, and you can prescribe the phenytoin capsules or phenytoin tablets, and I have shown many of the preparations are there. If you go to the SIMS or any other drugs, we can get the trade names, and mexiletine and also the tokenide you can use, or else you can also use the propranolol. It's a very commonly available drug, so for 5 milligram doses. And apart from this one, some literature also say that the atropine sulfate may be effective in the initial stages to prevent the atrioventricular block. That also can be used. And many times, if you prevent the calf mortality to the greater extent, we can save a lot of money to our beloved farmers. And later, these cows become the asset to our country. So with that, I'm going to end this presentation. Thank you very much for everybody for patient hearing for such a long time, 1 hour long time.